Hello, everyone, on World Cognitive Behavior Therapy Day. My name is Richard Gallagher. I'm here from New York at the NYU Grossman School of Medicine and also representing the Association for Behavioral and Cognitive Therapies. I'm going to be talking today about the cognitive behavior therapy for youth and understanding that services and those treatments as they are applying to kids and adolescents. So let's go ahead with the slides. I want to be able to talk about the overview of mental health and mental disorders in youth, talk about key considerations in mental health, discuss briefly cognitive behavior therapy and how it can help, and have some resources for places to find out more about cognitive behavior therapy. And you can send questions to me with my email address, and I'll be working on answering those for the next few days. What is mental health? According to the World Health Organization, mental health is a state of well-being in which the individual realizes his or her abilities, can cope with the normal stresses of life, work productively and fruitfully, and is able to make a contribution to his or her community. And these are the signs of mental health in summary. We talk about well-being, managing difficulties, working towards goals consistent with personal values, and social connection. When we talk about youth, the signs of mental health include well-being, where kids are emotionally stable or they're able to return to a good state after being a little emotionally disrupted. The kids manage their difficulties, and in particular, they meet the demands that are placed upon them at home and at school, and they're responding also to some of their peer interactions and the peer demands. With children and adolescents, it's often working toward goals that are consistent with their personal values, but also, again, the family values that have a really significant influence on children and teenagers. And then there's social connections, where the kids have good relationships at home, have good relationships with their peers, and they have good relationships at school with their school personnel and other places where they do spend a lot of their time. Mental health does exist on a continuum. There's a variety of signs of declining or poor mental health. These are signs and symptoms that can be present in adults as well as kids and adolescents. There's problems with sleeping or eating. There's often difficulty with concentrating and focusing. There's a sort of feeling of moody or being irritable. And also, then we do talk about with the inability to cope with stressors, we can talk about anxious, dysphoric, or unhappy responses, or aggressive responses, which is a concern for all people of all ages. What we do think is that poor mental health can often be resolved through engaging in positive coping strategies, engaging in self-care, or in the case of children and adolescents, getting care from others, where people are involved with the process of like checking in on them and helping them manage, and through accessing different resources. Again, kids and adolescents often have to get the resources accessed through their parents, their school system, and the adults around them to be able to help them make the connections. We do believe that almost everyone experiences poor mental health during their lifetime. And again, that can certainly be for a certain temporary period of time. But when we do talk about youth and adolescents, we are talking about that about 20 to 25% of kids and adolescents before the age of 18 experience an emotional, behavioral, or learning problem due to some mental health issues. It's not that uncommon, and this is something we want to be having everybody be aware of. There are a range of mental disorders. They affect the emotional, psychological, and physical well-being of an individual. They are marked by disturbances in thoughts, feelings, and perception that are severe enough to affect day-to-day functioning. So temporarily, our thoughts can be disrupted. Temporarily, our feelings can be disrupted. And temporarily, we may see things in a way that's unusual. But those are temporary. When it does affect day-to-day functioning over and over again, we are starting to talk about a mental disorder. In the case of children, their thoughts, for example, can be disrupted by being afraid of a lot of different situations, or situations in which they have to function and thinking that really negative things are going to happen. It could be something as much as, being afraid of the weather. because of hearing about negative weather that have been serious problems, but they get concerned about small changes in the weather. Feelings can get disrupted. Kids can have long periods of time of being anxious, long periods of time of being unhappy, long periods of time of being really angry. And their perceptions can be off in that they can believe that other people don't like them, when in fact that's not true. They can also begin to believe that they are not capable, again, when that's not true. And so those are some of the examples that can happen with youth and adolescents. Mental disorders are diagnosed by mental health professionals. They can also be pinpointed by general healthcare professionals, and who then refer them on to mental health professionals. But very often the pediatrician or sometimes a school person is responsible for pinpointing a concern that an adolescent or child has. Most often mental disorders are temporary and are best treated as quickly as possible with a proven treatment model. There's plenty of science going on that's looking at what treatments are effective for the mental health disorders. And what's interesting, what's really important for thinking about children and adolescents, is that most mental health disorders that are seen in adults, even serious ones, do actually start in childhood or adolescence. So there's precursors to these serious adult disorders in the child and adolescent years. So catching things in the child and adolescent years can often result in a situation where adults don't experience the same severity of concerns as possible. We have information in the field that indicates that people don't go for mental health treatment sometimes for years. And it can be that the conditions get to be very persistent if they're not addressed early on. The mental health continuum model, which is an indication that there can be healthy all the way to ill situations, again, indicates that there can be these possible mental health states. And they're marked by a range of symptoms and signs as shown in this next slide. At a healthy level, if we talk about mood, we can have normal fluctuations in mood. We're not happy all the time. And you're reacting to things. You can be nervous, you can be irritable, you can be sad. When you're in a state of being described as being injured, you often have anxiety that is more than just nervousness, anger, there's pervasive sadness and hopelessness. And then when you're ill, it's an excessive anxiety and easily enraged and very depressed. Sleep can be disrupted at different levels, from normal sleep patterns, trouble sleeping sometimes, but then also getting all the way to the being unable to fall asleep or stay asleep, or often sleeping too much. People can be physically well, but the mental health conditions are associated with concerns that can go all the way to exhaustion and physical illness, with being tired, having headaches, fatigue and aches and pains in the middle. Performance is a real important issue with regard to work, but also with regard to school. Healthy is a person that's able to engage in relatively consistent performance. Reacting is not doing so well and maybe sometimes procrastinating before getting involved with doing an activity. Being injured is resulting in very decreased performance. And then if you're ill, you're unable to perform your duties. When we do talk about this, this is with children and adolescents, we find that issues in school are where there's reflections of these decreased level of performance that can happen when there's an anxiety disorder, that can happen when there's a depressive disorder, and can also happen with some of the stable issues in kids, such as attention deficit hyperactivity disorder, where kids do have trouble organizing their actions and organizing their attention to be able to complete tasks well. A socially active person is someone that's healthy. Doesn't mean that you have to have lots and lots of friends, but you have the appropriate number of friends for yourself and the appropriate number of social contacts. When you're reacting to problems, you're going to be having decreased social activity. You begin to get involved with social withdrawal. And then in terms of illness, there's often a situation where people avoid social events and get isolated. In the case of kids, some kids do get involved with isolation and don't get involved with talking with people outside of their family. And although it doesn't affect children too much, certainly adolescents can start to have some issues with regard to substance use, where, again, we really recommend that this not be something that's engaged in until kids are 21. We know that the adolescent brain is very susceptible to issues with regard to substances. But adolescents can have some trouble and impact due to substance use. There can be increased trouble, and of course, with the law, with school officials, and at home, and it can result in dependence. And only at the level of being ill do we think about suicidal thoughts and intentions. That's really one of the most extreme situations, and there's really no mild version of that. When we think about risk and resilience, we're talking about what puts a person at risk for a mental disorder, and how are people resilient? How do they recover from conditions? No single factor can explain the occurrence of these problems. It's an interaction of many different factors, some of which increase risk and others that foster resilience. There's a biopsychosocial model of illness that thinks about the biological factors in the illness, the psychological factors, and the social emotional factors that work together to foster mental health, or in some cases lead to challenges or trigger a mental disorder. People are integrated biopsychosocial entities. In other words, people are complex. They're affected by biology, they're affected by psychology, they're affected by their environment and social factors. And we do need to think about all these factors when we do consider people's conditions. This is a little model of some of the factors that are involved. And some of the psychological factors for children are that they have certain beliefs about themselves, certain attitudes towards school, certain attitudes toward their peers. Kids can have very negative thinking. They can have also a sense of hopelessness and helplessness. And they can also psychologically not engage in some of the best thinking with regard to their skills and ideas. In some cases, kids can have also excessively positive thinking about themselves, thinking, oh, this is not a problem, I can handle anything. Certainly, we are finding out more and more that there are biological risks in kids' mental health problems. There's genetic risks. Some of these conditions, unfortunately, run in families. And that's important information to know, to be able to recognize that your child might be at risk for some condition. It does affect biochemistry. It does affect the body's regulation and what we do on a regular basis. And then again, if there's substances and drugs involved, that's certainly a biological factor. And social factors do play a part as well. If there's a past history of trauma and a harsh environment, if there's family issues, kids are especially sensitive to this in their caregivers and other persons. If there's limited social support, if there's a lot of negative events, then that's a problem. And sometimes cultural beliefs can contribute to mental health problems that don't get addressed, because people will think, oh, this is just a phase and kids are just going through it. And kids are not in a serious enough state to have a mental health problem. That can be a cultural belief that is actually a limited understanding of kids. We want to think about life, living in a stressful world, especially some things that have been happening lately. Life involves stress. The World Health Organization defines this as any type of change that causes physical, emotional, or psychological strain, sort of putting an extra tension on these physical, emotional, and psychological systems in our bodies and brains. There's major forms of stress for youth. There's family interaction problems that can be stressful for youth. There can be loss of close relationships that can be a problem for youth. Sometimes in the case of family parents separating, sometimes in the case of losing a close member of the family. And kids are often quite reactive to the loss of a grandparent, for example. There can be peer interaction problems, and as it's being explored, we know that can happen with in-person, and even more so, there's a lot of concern about what's going on with virtual peer interaction problems. There can be challenges in school that leave a lot of stress to kids, including some learning problems, difficulties learning to read and write and conduct mathematics. Excessively harsh discipline for kids is something that is also something that is very stressful for them. And recently, we do know from kids with increased levels of anxiety and depression overall in the population that this seems to be the result of the impact of COVID-19, with some kids having to grieve the loss of persons, and also the restrictions that limited how much kids were spending time with their peers and sometimes being stuck at home and having everybody getting very tense because of being all stuck at home and not getting any relief from that process. Most people do manage most of their stressors most of the time, and that is true for kids as well. No single strategy or works for every person. Telling everybody to get involved with deep breathing doesn't work out. That doesn't make a difference for some people. Some kids would find that that really is quite, boring, and they may want to run around as a way of kind of coping with stress or getting involved with some physical activity. People usually rely upon some tried and true strategies, which are good for them, but kids often have to find a way and try some new things out before they get a stable way of coping. Problem-focused coping tackles stressful situations directly. It's recommended over avoidance or emotion-focused coping. So in other words, getting all, distressed and emotionally involved as opposed to figuring out what to solve the problem with is not a good coping strategy. Getting really angry and frustrated by things is not a great coping strategy. And then avoiding a situation, even though it makes you feel a little bit better, doesn't usually take care of the problem. And we certainly don't want kids to get involved with that problem. Coping strategies for kids also often involves getting help from parents, other caregivers, school personnel, health personnel, friends, mentors, and the people around them. But in order to use that coping strategy, we want to make sure that youth and kids and adolescents know that they should reach out to people and tell people if they're not feeling well, if their emotions are troubled, if they're having a concern that they can't figure out what to do. Kids shouldn't be left in a situation where they have to deal with this all by themselves. Now, one professional coping strategy, one thing that's useful, is cognitive behavioral therapy. Cognitive behavioral therapy is a method of treatment that involves looking at people's thoughts and behaviors. It's been a treatment that's been developed over the last 50 years. It's been heavily studied. It's been shown to be helpful for many problems, and stress and anxiety in particular. It's been used in many countries with success. And with kids and adolescents, many of the programs have been developed in the United States and other countries, but they've also been translated into programs in lots of other countries around the world. Cognitive behavior therapy is an evidence-based model of care. It has been looked at, it's been investigated, and it is important that when you do look for cognitive behavior therapy and mental health concern, that you get it from a reliable and evidence-based sources. You want to make sure that there's been some test to make sure that this works. The cognitive behavior therapies for child and adolescent problems are well developed, and many conditions improve quite significantly using these methods. What happens in cognitive behavior therapy is that there's a recognition of the problem, a kind of defining of like, what is going on? What is the concern that you have? I am anxious about getting involved with talking in my classroom and talking when the teacher calls on me. I am feeling really sad. My friendships are not working out well. I'm getting really depressed. There's a kind of description of like what specifically is going on. We try to put the problems in focus. We try to be able to help make sure that they're put in perspective, that we recognize that they are problems, and we try to be able to have people understand that they are problems that can be addressed. Especially true for kids, cognitive behavior therapy involves training the kids in new and possibly more effective coping strategies. This also may involve helping parents learn how to coach the kids to use these skills in their day-to-day lives. When we do therapy, we only see the kids part of the time. We often have to ask caregivers to help out with that. We want to be able to have the kids begin to recognize any kind of thoughts that interfere with coping, such as, oh, this math work is too difficult. I can't handle it. I can't do it. I'm going to get really anxious and angry about it. We want the kids to recognize that if they do learn the strategies for math, that they can get through it. And we want the kids to work on approaching the problems in structured ways. Excuse me. Cognitive behavior therapy also involves assessing outcomes and looking to see if things work or not work. So if we try deep breathing and somebody says, I'm sorry that that's not helping me out that much, we might shift over and say, okay, let's do muscle exercises and muscle relaxation training. Excuse me again. Cognitive behavior therapy directly targets unpredictable behaviors and uncontrollability. We try to be able to have people think about, what can you understand that's predictable about a situation, and what can you do to engage in controls of yourself and the situations around you as much as possible. Cognitive behavior therapists and clinics can be found in many countries. The World Confederation of Cognitive Behavior Therapy, for example, is a global alliance of organizations and lists of organizations and resources. You can go to www.wccbt.org to find out information about situations in your country. In the United States and also around the world, there's the Association for Cognitive and Behavior Therapy at www.abct.org, and also the Child Study Center and other centers of mental health for kids and adolescents do have many resources, and we have our website that is listed there that have a number of different resources on the different conditions. I wanted to thank you for your time. Within the next number of days, I will keep track of emails that come in my direction, and I will work on answering those as well as possible and give broad ideas about what to think. I cannot give you information about what to do in your exact situation. That would be inappropriate, but I can give some broad ideas and suggestions on where to turn to for some possible assistance. Thank you for your time, and I hope you have a good World Cognitive Behavior Therapy Day.